Now, let's discuss the pathophysiology of hypercoagulability in patients with COVID. To know the causes of hypercoagulability, we should be well versed with something called as Virchow's triad. Virchow determined the three most important critical factors in formation of thrombus include endothelial injury, stasis of blood, and hypercoagulability. Now we'll discuss each of these one by one. That of what happens exactly in SARS-CoV-2 infection. SARS-CoV-2 virus mainly causes infection of the endothelial cells, okay, with the help of the ACE2 receptors which are present on these endothelial cells, leading to endothelitis. And this does not only occur in the pulmonary vasculature but in almost all the other organs. Okay, and this endothelitis becomes one of the key factor in formation of thrombus or clot. The major risk factor that leads to formation of thrombus is venous stasis. Now venous stasis is mainly seen in people with old age, okay, with immobilization, patients of stroke or patients of spinal injury. Okay, there is venous stasis also occurring in patients who are obese, pregnant patients. All these leading and becoming one of the risk factors for formation of thrombus. Next, before we discuss about hypercoagulability, I would like to discuss about the coagulation cascade. Now, the coagulation cascade mainly consists of two pathways, that is the intrinsic pathway and the extrinsic pathway. The intrinsic pathway, whenever extrinsic pathway, okay. Now, in the intrinsic pathway, whenever there is injury to any of the blood vessel, okay, so whenever there is injury to any of the blood vessel, it leads to activation of certain factors or the coagulation factors. Now the first coagulation factor that is activated in this is factor 12. Okay, this on activation causes activation of factor 11. This then causes activation of factor 9. This in presence of factor 8 causes activation of factor 10. Okay, now the activated factor 10 mainly causes activation of factor 2. This activated factor 2 will further cause a conversion of fibrinogen to fibrin. Now we know that the clot is made up of mainly, or thrombus is mainly made up of the fibrin. Now this fibrin in presence of factor 13 or the fibrin stabilizing factor leads to formation of a proper clot. This is the intrinsic pathway. Now in extrinsic pathway, tissue factors play a major role which cause activation of factor 7. This factor 7 causes activation of factor 10, leading to again clot formation. Now this is the coagulation cascade, and now we know how a thrombus is formed from intrinsic pathway and the extrinsic pathway. Next, how SARS-CoV-2 causes activation of all these factors leading to clot formation. Now we need to remember that SARS-CoV-2 overall causes activation of the entire coagulation cascade. Okay, it also causes an increase in the level of von Willebrand factor, a component of factor 8. Also, it causes activation of tissue factors. Okay, now SARS-CoV-2 also causes hypoxia. Okay, now this hypoxia is one of the inducing agent for thrombus formation. So by various mechanisms, SARS-CoV-2 leads to thrombus formation. Since we know that the coagulation cascade plays a role in thrombus formation and thereby leading to injuries in various organs, there came the concept of use of anticoagulants in the treatment. Okay, of which the most commonly used, like unfractionated heparin, which works by inhibiting factor 10A and also by indirectly or directly the factor 2A. Okay, the low molecular weight heparins which are commonly used act by inhibiting the factor 10A. Now since these factors since low molecular weight heparin inhibit the coagulation cascade, they prevent thrombus formation and thereby preventing further injury. Do like and subscribe our YouTube channel for such videos. Thank you, friends.